Hello and welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we're here with you on the fourth Wednesday of each month at noon to bring you information about programs related to Southeastern Health. And today I'm excited to welcome to the studio Pastoral Care Services Coordinator, Reverend Dean Carter. Welcome, Dean.
Thank you.
And Volunteer Supervisor for Southeastern Health, Miss Janna Osman.
Thank you.
And we're going to start with Janna today because this is National Healthcare Volunteers Week. And we mark that every year with a banquet for our volunteers and a number of different recognition opportunities. And Janna is going to introduce herself, tell us a little bit about herself and her role, and then we'll talk about what important role and benefit that volunteers are to the organization. So Janna, if you would introduce yourself.
Thank you so much, Amanda. My name is Janna Osman. I am the new volunteer supervisor over the volunteer program for Southeastern Health. I've currently been in this position for 7 months. And as Amanda spoke, we are celebrating National Volunteer Week this week. It's from April 24th to April 28th. And the Volunteer Week is very special to our organization. This gives us an opportunity to acknowledge all of our volunteers and all the wonderful time and talents that they've given to our organization. They play a very important role in our hospital. They help our hospital run smoothly. They allow doctors and nurses to spend time focusing on their jobs to provide the best health care possible to our patients. And they serve in many, many areas in our hospital. They can serve in areas like nursing units, at the front desk, coffee cart. They're in several areas where they have lots of contact with patients and families, and they truly enjoy that. For our Volunteer Week, we did have a banquet last night, and we actually acknowledged several volunteers. Over the past year, we have had 72 adult volunteers in the main hospital area, and that includes the Fitness Center, Gibson Cancer Center, and at Woodhaven. We had 60 junior volunteers last summer, and we have 32 pastoral care volunteers we acknowledged. We have 35 camp care volunteers that we acknowledged last night, 47 hospice volunteers, and 19 volunteers that are friends of hospice. So it's a wonderful group of people that we had, and they thoroughly enjoyed the banquet.
It's a large group.
It is.
And so I know each year at that banquet, a check is ceremoniously presented on the value of that volunteer service to the organization. So tell our listeners what that amount was this year.
Well, the amount was actually the largest that they've had, at least within the past 5 years.
Okay.
The total amount of the check presented was a cost savings to the organization of $420,245.61.
Wow.
And
that needs a drum
equated-
roll or some kind of sound effects behind it, doesn't it?
That was over 17,000 hours
Wow.
that our volunteers volunteered for the organization.
Can you imagine the void that would be if those folks were not there providing that volunteer service?
No, I cannot imagine.
That's wonderful.
It was clearly said last night by our guest speaker that imagine a world where there wasn't a volunteer.
Exactly.
And if you take a look at that, you probably don't want to know that world.
That's right. That's right. So, and just think about the benefit for them, too. They're not getting a paycheck, but boy, are they getting the reward from knowing that they're contributing and the interactions that they get with people every day and opportunities and benefits that we offer. And this recognition every year is important to show them how valuable they are to the organization. So.
They really do, because most of our volunteers right now are currently retired.
Mm-hmm.
So they actually bring life experiences.
Oh, absolutely.
To the organization, just skills that they had maybe from a previous job,
Mm-hmm.
or they love to interact with people.
Mm-hmm.
So it's really fulfilling for them. I've had volunteers say that this is the best job they've ever had.
Yeah.
So.
The one they choose, right?
Yes.
They choose to be there. So
They do. They do.
That's great. So are there any other things throughout the week that we do? Recognize them with a banner or?
We do. We have a National Volunteer Week banner.
Great.
In recognition of them right outside of the cafeteria.
Mm-hmm.
We also give them little treats during the week, maybe a nice little thank you card. But the volunteer banquet is definitely the big acknowledgement.
Great, great. So say someone's listening to us and they might say, well, that sounds interesting. I've got some free time on my hands. I'm a retiree, or I work part-time and want to contribute to health care and to people who are in need or maybe experiencing a challenging time when they may need to access health care. What process do they go through to apply to be a volunteer?
Okay, well, there's actually an application, and it can be found on our main website, www.srmc.org. Hover over the career tab, and it'll create a drop-down box about becoming a volunteer. Scroll down to the bottom of that page, and you can find the application and actually orientation handbook, everything that you need to read. You will need to print that form out and fill it out, and you can mail it in to me or return it to me in my office. You can also come by my office and see me, and I'll be glad to give you a volunteer application.
In your office, as you go down the main corridor and you would go towards the Human Resources Department,
That's right.
take a left.
That's right.
If someone needs some guidance, they can certainly ask at the front desk.
Yes, at the front desk, they'll call me, and I'll be glad to go down and meet you.
Great, wonderful. So what about our junior volunteer program? Summer is around the corner, and I know that is a large undertaking. You mentioned a large number of junior volunteers last year. So if you would also, in case there's a parent or a family member that has a teenager out there that may want to fill their summer hours with something productive, how can they apply for our junior volunteer program?
We currently have that application is open. That can also be found on the main website, srmc.org, or you can come to my office and see me, and I'll be glad to give you an application or mail one out to you. The summer volunteer program will have orientation middle of June 15th and 16th, and then the actual program will start on June 21st. But if your child has a desire in the medical field, or they just would like to volunteer, if they need volunteer hours, if they can use them for their school, or if as a parent you want them to have something to do,
Right.
that would actually be worthy. Please call me.
Now, do you match them up, as I guess you do the adults? You ask them probably through this process what's your areas of interest, and then you try to match them with that department. Say someone thinks they might want to be a pediatric nurse. If there's opportunities within the maternal child health department, I'm guessing you try to match those as closely as you can.
We do, because the volunteer program, it's more than just you donating your time to the hospital. I do want you to enjoy it, and feel like you have learned something from it. So that's very important to me. I will try to match teenagers up to where they want to go as best as I possibly can.
Sure. And there's a grade requirement. You have to have a certain average, correct?
There are actually 2 forms in the application packet that have to go to 2 separate teachers, and then one that has to go to your guidance counselor. So we just have to have some information from their teachers and signatures, and then they should be on their way.
And they have to wear a uniform. They have to be prepared. Do we provide that, or is that something that they're expected to provide?
That's something that the parent of the teenager is to provide. It's khaki pants and a white polo-style shirt. And then we give them a patch that goes onto the shirt for the junior volunteers.
So, and during the summer, if any of our listeners are ever at the medical center, you can actually see these folks around. They're very
They'll be acknowledged.
recognizable, and they are, as the adult volunteers are, they're filling a very important role helping out during the summer. And some of them may be exposed to an area like medical imaging and decide, I want to be an x-ray technician when I go to school. So it's an excellent opportunity for exposure for them as well. So, well, let me give out your number. It's 910-671-5093.
That's correct.
If anyone that listening is interested in becoming a volunteer themselves, or they know of a student who's in high school who would need to meet the qualifications for the program, but can give you a call and get more information. Or as you mentioned, they can go to srmc.org or southeasternhealth.org, hover over careers, and then there's a volunteer opportunity, full page of information there. So that's great. Well, we certainly appreciate our volunteers and look forward to this week every year when we can recognize them during National Volunteer Week. So thank you, Janna, for that information.
You're welcome. Thank you.
We're going to transition now with Reverend Dean Carter. As I mentioned, he is the Pastoral Care Services Coordinator for Southeastern Health, and he works with those volunteer clergy that Janna was talking about. There's unit-specific clergy that he works with. But the main thing we're going to talk about today is a Compassion for You program that Reverend Carter has spearheaded. And if you would introduce yourself and tell us a little bit about how this program has come to be.
Sure. My name is Reverend Dean Carter. I've been at the chaplain at Southeastern I'm working on my 23rd year now. So I've been there since 95. And most everything that's surrounding pastoral care now is being enveloped into our U-Care model. The U-Care model is a patient-centered type of care where instead of inventing a program, opening the doors and saying, y'all come fill our program, instead we're trying to become more in touch with what the patient desires, what the patient needs, actually asking the questions, even getting out into the community to ask those questions with health fairs, community engagement, all built on a model that I wanted to talk about. Before I go there, I wanted to add to Janna's comments about how you might volunteer for the pastoral care program. Mm-hmm. Most likely you're going to be engaging me to get a badge for pastoral access to the hospital for your particular church as you come to the area as a pastor. If you come through Janna seeking that type of volunteer engagement, we welcome that, and she's probably going to refer you over to me so that we can have that proper fit of where you think your talents are, or maybe even you have some goals for emergency care or the cancer patient or other ministries. Like I will tell you that we have started a transportation ministry. Mm-hmm. And there is a retired educator who is also a minister who's putting in a vast number of hours making sure that folks are connected to their appointments. And I'll call his name out by permission. Reverend William Gentry helped us to begin that. And within Compassion for You, he's what is known as a connector. And his main role is to have relationships with folks, many times introduced by our Gibson Cancer Center. Mm-hmm. And what he does is make sure that that person who might not ordinarily have the transportation opportunity to keep an appointment, he can provide the vehicle and the time to pick up that person, bring them into Gibson Cancer Center or the hospital or other venues. He's actually served several venues. But also get them back. And on the way, he's still being a pastor. He's still recognizing that there's spiritual pain and angst. And what a great place to do that is on the way to the appointment.
While you're riding in the car.
There's absolutely relief. It's sort of like having your best friend ride along with you
right.
to something that's pretty nerve-wracking. And I would add also, most of us going to an appointment aren't familiar with the hospital world or the clinical world, so we fear what we don't know.
Absolutely.
And that is a spiritual pain. So I think William, and actually there are 3 others who have joined him now doing various versions of this, such as we have someone concentrating on behavioral health transportation ministry, and that's often a place where we might see someone not engage in an appointment just for the fear of it. When there's addiction or a mental disability, a behavioral disability, social disability. So getting those folks to appointments to manage medicines and those things, it's often shirked. So if you can think of it in terms of a cycle, if we connect folks to their appointments and have them at ease getting there, then health rises. Health cyclically goes up, improves. But if they don't, and they begin to be lost in the system, drop through the cracks, as people call it, then health, physical, mental, spiritual health, the person tends to cycle down, and we begin to lose them out into the community. And that's a horrible thing to note, that our health outcomes actually become worse because somehow we weren't being friendly enough to actually help them get what they needed to get. I think a transportation ministry is awesome for that. And we are constantly seeking funding to make that happen. To mention some others, We've had some church folk that were not pastors to join us, but actually the two others are retired men who were successful in their careers, and they do not wish to be mentioned by name. But nonetheless, what they want to give is out of the goodness of their heart.
Sure.
They want to provide that ride, be that friend, and it doesn't require theological training in order to do that.
So if someone's interested in helping that group, would they call you or would they call, okay.
I think they should call me first.
Okay.
It makes sense to get them connected to the fellows who are already doing this. And by the way, I do know of a church or two that has taken this on, and actually there is a lady doing this in one of those churches. So it's not male only. Don't want to cast that shroud over it. In fact, I think it's wonderful how the human being engaging another human being is just a beautiful, pure ministry. If we can,
if you'd share your number, share
Sure,
your phone
sure.
number so they can.
The office number to contact would be, of course, 910 is the area code, 671-5031. Or if you want to call Janna's number, she can get you to me. But 671-5031, and I would be glad to speak with you about any of these ministries.
Now, I would assume you would need your own personal vehicle for the transportation part.
You would have to have a
Okay.
valid North Carolina driver's license. We are working on staging a vehicle that the hospital would own that could be used. It's not in service right now, so I'm holding back on saying much about that.
Okay.
But to a large extent, you would need to have a vehicle, and the insurance, of course, would be on you as a driver to provide that friendship transportation.
Okay. So, Compassion for You, how did it start? It's a long story, right?
Yeah, Compassion for You is complex to say the least. But it, as we roll it out, or as I describe it to you, you're going to see that so many spokes of the wheel that all come back to this same type of human-on-human service. Compassion for You has as its base model what is called the Memphis model, a phenomenon that happened at Methodist Le Bonheur Hospital in Memphis, Tennessee, the home of Elvis and all that. This hospital took on the idea of community engagement, actually forwarding something learned through missions effort from Cape Town, South Africa. Back in the 1990s, Dr. Gary Gunderson, Dr. Teresa Cutts, Dr. Jim Cochran, several that I could name in that movement, were all tied to various places around the world, but they learned something significant from the ministers of Cape Town, South Africa. In that culture, there is a word, and I think I'm pronouncing it right, Mbofele, but it means that when you ask your neighbor about his or her health, at the same time, you are asking them about their spirit, their faith. And vice versa. When you ask about their faith, it's not separated at all from health. So you're asking about a very holistic sense of how are you? Much like God visiting in the garden with Adam when Adam and Eve were hiding, he had that great question, "Where are you, Adam?" And I don't believe for a minute that God did not know where Adam was.
Right.
So what was the real question there? Well, it was a way of saying, how you doing? What's going on with you? How are you physically? How are you mentally? How are you spiritually? So I don't think you can separate the human being. Well, in that culture, they're teaching us how that we can pay attention to the vast parts of what it means to be a human being. Okay, so bear in mind that could talk about insurance. That could talk about where and when is church or faith available to you. It could mean something about your neighbors. It also means carrying on the assets in a neighborhood. Like, where does your communication take place? It might not be the radio station, God forbid. Sorry about that. But it might be the beauty shop or the barber shop. It might be the local grocery store. It might be where we commune and actually share with one another, how are you doing? Okay? So the idea is to connect and relate as human beings at the most basic of needs. And it's a beautiful model as it worked out. Now, hospitals all across the country have sort of began to adapt the Memphis model. There's a larger movement called Stakeholder Health. Much of this centered around the leadership, which is now located, these same people that I've mentioned, are at Wake Forest Baptist Medical Center, and getting a great boost from funders, grant funders like Kate B. Reynolds Charitable Trust, Duke Endowment. We've recently had a touch from North Carolina Med Assist that was sent to us as a program, an event for us to manage, but that was birthed out of Kate B. Reynolds Charitable Trust. Thousands of dollars have been brought into our very neighborhood here in Robeson County because of these efforts. Was also asked to mention by leadership that we have an accolade according to this model, that back in 2013-14 in that grant writing season, we had a chance to write for a Health Services Resources Administration grant. That's a portion of the Division of Health and Human Services of the federal government. So Robeson County, actually Compassion for You, had the honor of receiving the first ever faith-based health-related dollar from the federal government. Wow. That's right here in Robeson County. That was $85,000 for a planning grant that landed here and gives us a basis for much of the material we use to carry on Compassion for You objectives.
Congratulations.
Thank you.
I'm sure hours went into writing that grant as well.
Very much so,
Yes.
and many more in trying to carry out all the things
Right.
that you have to do to satisfy federal
Absolutely.
government. Yes.
Absolutely.
Add to that our data that goes along with that, like our health outcomes, constantly being measured, and to be more exact, the impact of doing such a program. How those dollars are used had to be measured. And there you bring in the Duke Endowment grant writing piece, and that brought $12,000 into our neighborhood. Why would that be important to you? Because those are the very gas dollars we're spending to get the transportation ministry done.
Right.
So we're
okay.
folding all
That's
that
how it
back
all
over
comes
into
together.
service. Yeah.
Wonderful. Wonderful. So who does this serve? I know you have partners with Compassion for You. You have
Yes.
churches and businesses that are called, I believe, Covenant
Covenant Partners.
Partners. There we go.
That's right.
And so if you would talk a little bit about once someone, a church or a business, becomes a Covenant Partner, what does that mean for them and for us?
At present, we have 15 churches that have signed the Compassion for You Congregational Wellness Network Covenant of Shared Commitments. That's a lot of words to say that we are trying to concentrate on working together, cooperating together.
Basically a commitment to a partnership.
Yes, and at very basic level, exactly what the bullet points are is that as an idea surfaced, will you help us? Will you cooperate with us to get that done? Like last Saturday, Antioch Baptist Church on Old Whiteville Road had a health fair. Well, there were a lot of experts that came out from Southeastern to help with that. But there was also the Robeson County EMS there to do a heart saver demonstration for CPR. I did advanced directives out there, the healthcare power of attorney, living will. We actually had 10 conversations and 4 completions out there, which is
Great.
pretty good.
That's great.
We did the sugar, diabetes, blood testing, height, weight, blood pressure. The church put on a demonstration of healthy eating, snacking, and all that. So if we ask for those kind of commitments, we also have the same agencies that were participating in the health fair. Many of those are on the list as agency partners, like the Public Health Department. And Campbell University School of Medicine joined us with medical students for the first time. We have as one of our partners the Robeson Community College Nursing Program. They provided 6 students, potential nurses, that came out to help us with the effort. So each of them get something from the organization and give something. It's a combination of those strengths, surveying a community for what it already has strengths, and then putting them to good use for everyone's health.
And the ultimate goal is for their parishioners and their community to be healthier. Not
Exactly.
only spiritually, but also physically.
That's
Right,
correct.
right,
That's correct. I had a contact from a church by email that I need to return, and it's someone that we had talked to before, but it looks like a covenant is coming actually from the Grays Creek area.
Wonderful.
So there is not just a local context. We're beginning to gain some speed about putting health fairs, these kind of engagement activities into churches all over our area. So I invite you to use the same phone number, 671-5031, to contact me about Compassion for You, a full explanation, and then maybe we can agree in a covenant if your pastor and if your church leadership agrees that that's a good direction and the right timing for your church to join us.
Wonderful. So what's on the horizon for Compassion for You?
Next up to bat is Camp Care.
Okay.
Camp Care is a bereavement event for children that will be staged this year on May the 20th. It will occur at Antioch Baptist Church for the day as a venue, but we'll be using that venue to talk about basic grief support needs for children. It's the assumption that children have not had the experiences about grief that they need to formulate their coping mechanisms. So we're teaching basic grief coping mechanisms at the camp. For 8 to 16-year-olds, you can go to the hospital website and register there, or you can again call that 671-5031, talk to me, and we'll help get the child registered. It's a $20 cost per child. If you'd like to help defray that cost for some children, I would welcome that call. Or if you need to put children there, realize that we do gather some scholarships so that no child has to be turned away for grief needs for reason of money.
And they do not have to be a recipient of our services.
Correct.
It can be any child in the community that's experienced the loss of a loved one.
Southeastern Hospice is responsible for educating the volunteer, manning the camp. We do take volunteers from other areas, other agencies, other common folk from all walks of life, and give them the education of what they would need to emotionally cope with the camp. But no, we do not have to be as a result of a Southeastern Hospice patient. Any child who has a loss by death and fits the age range of 8 to 16 may apply.
Wonderful. Well, that concludes our show. We're out of time. The clock has just flown by. So the time has flown by. So I'd like to thank Janna Osman. She, again, is the volunteer supervisor for Southeastern Health, and also Pastoral Care Services Coordinator, Reverend Dean Carter. And just again to provide those numbers for Reverend Carter for the transportation volunteer opportunity, for Compassion for You, or for Camp Care, you can call 910-671-5031. And for Janna, for any volunteer opportunities throughout the organization, for adults or junior volunteers, you can call 910-671-5093. So thank you for listening. Join us next month for Southeastern Health's Healthy Connection.